gentlemen, honourable ministers, friends, colleagues, all protocol observed. It is my absolute pleasure and privilege to welcome you to Cape Town, to South Africa, and for some perhaps to their first visit in this magnificent continent of Africa. Welcome to this third Global Health Systems Research Symposium. Welcome to #HSR 2014. Sianumkela nonke. Bienvenue, bienvenido, karibuni wote. My name is Lucy Gilson, and I am co-chair of the South Africa Local Organizing Consortium. And I welcome you on behalf of all the co-hosts of this symposium. That is Health Systems Global, the Alliance for Health Policy and Systems Research, WHO, the South African National Department of Health, and the Local Organizing Consortium itself, which is comprised of the universities of Cape Town and the Western Cape, Stellenbosch University, Health Systems Trust, and the South African Medical Research Council. It is now 4 years since the global health systems community first met in Montreux, and 2 years since we met in Beijing. This third symposium is a marker of our development as a community. Health Systems Global was dreamed about in Montreux, launched in Beijing, and welcomes you with all open arms to Cape Town. There are over 1,700 of us present in the symposium, drawn from around 90 countries, comprised of activists, scientists, educators, managers, politicians, based in local, national, and international settings.
Greetings from the World Health Organization in Geneva. The work you will be doing during this symposium, the issues and ideas you will debate are absolutely essential. I believe the world and its leaders are finally ready to recognize the vital role played by health systems research. Health systems must be people-centered. They must respond to the needs of people who receive services, and not just the needs of those who deliver.
Nothing's more important than global health, as I think we're learning, especially this season of Ebola, that all health and healthcare has to be interrelated, and global health conference and sharing is a way to move in that direction.
I think that it's become increasingly clear over the last decade really that health systems are the key constraint to being able to achieve major improvements in global health. And it needs to be a key facilitator instead. And I think at this symposium, pretty much everybody who's seriously thinking about that question is here. They're talking about it, the debate's moving forward, and really, if you're interested in that question, you want to be here and be part of that.
There are certain aspects of science that get de-emphasized. I know that over the years, clinical research has always had a lot of funding, a lot of support, but with programs over a number of years having been disintegrated, fragmented in terms of implementation, we are seeing the importance of health systems integration. And what I take home, my take-home message is integration, not of health systems related activities, but also programmatic work and health systems. And what has been ignored also over the years has been community participation. Now, community participation is probably going to inform how we formulate policy, and also how we share our findings with communities, because sometimes we share the findings amongst ourselves as researchers and policymakers, and the communities don't understand and what the findings mean for them. And this is one opportunity that we have, and this conference was important in bringing the people at the center of the conference.
I think from this particular conference, and having seen the progress it's made since the Health Systems Research Conference has started, I think I'm taking away the way it is actually moving towards the people that matter in terms of what the research is trying to provide. I'd like to see that the processes, yes, research is important. All types of research is important at our level. But I think I'd like to see that the processes for collecting the evidence, yes, engages those that it will affect. At whatever level, whether it's the local community, it's the health worker, the decision maker, the policy maker, even the researcher, because they need to be, the power needs to be in the right place in this process. Yeah, and in that sense, I think if we get that right, then the questions of whose knowledge and who is asking the questions, I think becomes relevant and becomes validated.
This particular symposium is focused on the person-centered health services, and this is very topical and very important. So as the world is considering moving forward towards universal health coverage, the world also needs to consider what kind of service delivery they will put in place. We are in a situation where it is important at the same time to focus on the individual. The patient, the person should be at the center of what we want. They should be the one who inspire the type of services that they need, that they want. At the same time, we are facing a financial crisis, as we know. So the health system needs to be also more frugal and more cost-effective, and therefore all the discussion about integration is important.
The feeling that the community will receive the appropriate health care when they go to the health center. That trust between the healthcare delivery system and the community, we can see, is absolutely critical for not only sustaining the health system, but in responding to these outbreaks and other key issues.
The work that we do, let me say, for argument's sake, in Krabo, with the project, we have a Village of Hope in Krabo, which is an intervention for children who are affected and infected with HIV. And then we have a palliative care unit. That's got beds, and then we have called them Angels on Foot. We have 18 women who directly go every day for 4 days. They walk to meet the communities, because that the community of Krabo has got about 60,000 people and only one clinic. Certainly is not able to, assist everybody that needs help. So the ladies that are there, the sisters, they're trained nurses, they walk, they make sure that they get their medication, that they do take the medication, train, motivate them, and encourage them to stay on and not default. So the work is, it's humbling to me.